Hello, this is Dr. Tina. I'm glad to have you here in my channel, Glam Doc Tina. Today, I have entreated this topic before, but I did this presentation for Gye Nyame Channel, and I'm using same PowerPoint to present today. If you care to listen to this presentation in a different language such as Tree or mixed English and Tree, then I will encourage you to go to Gye Nyame Channel to go watch it. I did a presentation and I was able to use this slide speaking tree. Again, thank you for being here. I have a detailed topic about hypertension, and today I'm going to also go into the same topic. But since I have a slide, I chose to do it this way. So on my channel, this is the first time I'm using PowerPoint, but I have other topics that I'll be treating, and I'll be doing a lot of reviews about psychiatric mental health nurse practitioner certification exams and how the tips to help you succeed or pass your test. And so these presentations will follow suit like these. So have your seat and we'll go ahead and treat about hypertension, also known as high blood pressure. This same topic is on my channel and it's very detailed on that aspect. Today, the topic going to flow like this: the meaning of hypertension, the prevention, education, and treatment, and also the goal. What is hypertension? We have heard about this topic over and over, but what does that mean? So over here on the slide, it explains. And just so you know, I took most of these information from CDC, JNC 8, and other articles. And so this is evidence-based practice PowerPoint. So hypertension is known as the blood pressure, is the pressure of blood pushing against the walls of your arteries. Arteries carry blood from your heart to other parts of the body. So that what is it is that the amount of pressure that pushes this blood from your heart to the parts of your body through the arteries are so severe and high, and that is termed hypertension. Blood pressure, we have two numbers. We have the top one called systolic, and also we have the down one called diastolic. So both numbers come together, it's called blood pressure. So the systolic measures the pressure in your arteries when your heart beats, and then the diastolic measures the pressure in your arteries when your heart rests between beats. So normally we want it to be between the systolic to be around 120 and below, or 80 for the diastolic below. Danger of hypertension. What makes this critical? Because hypertension can lead to so many issues such as myocardial infarction, stroke, renal failure, and death. And so that makes it very scary if somebody has hypertension and is not treated or controlled. What are some of the signs and symptoms that we can see or hear or know? Unfortunately, blood pressure is called silent killer. The reason being that blood pressure doesn't have the symptoms. And so many people don't even know if they have it or not, because it can be silent. And so the usual names that we give it is silent killer. However, some people are so lucky. They complain of headaches, nosebleeds, regular heart, irregular heart rhythms, vision changes, buzzing in their ears. And so they are worried and they will come to the hospital or clinic, and we find out because they have high blood pressure. So those people are fortunate to have those early signs. However, most often, people will have high blood pressure and will not know. Risk factors. What are some of the causes, the leading factors that causes somebody to have a high blood pressure? Some people tend to have health conditions that can lead to all these high blood pressure or secondary causes. So diseases like kidney disease, adrenal gland tumors, thyroid disease, congenital blood vessel disorders, alcohol abuse, or obstructive sleep apnea. So all these things can lead to or cause somebody to have a high blood pressure. Other risk factors can be drugs that we take, such as NSAIDs, ibuprofen, naproxen, or birth controls, decongestants when you have cold and you need to take all these medications. These medications can cause that. Also, corticosteroids, such as prednisone, can also lead to high blood pressure. The risk factors, we have modifiable risk factors, and then we also have non-modifiable. So modifiable are mostly the lifestyles, such as excess salt consumption, diets high in saturated fat and transplant fats. All these can lead to high blood pressure. Physical inactivities, that is, not exercising, can also lead to somebody to have high blood pressure. Consumption of tobacco and alcohol can also lead to that, and also overweight. However, these can be modified, or these can be controlled because they are mostly lifestyle. However, there are certain things that can lead to blood pressure and we don't have a control over it. Family history. Um, if you are the first, let's say a parent and I have a high blood pressure, my child could also have that. Age is also another non-modifiable risk factor. As we age, we tend to have a high blood pressure just because everything in us begins to stiffen up, and that can lead to that. Other non-modifiable risk factors, such as sex, as the gender. Women are about as likely as men to develop high blood pressure at some point during their lives. However, male are very high risk. Also, race or ethnicity. So, Black people develop high blood pressure more often than other race. So, those are some of the non modifiable things we cannot do anything. If you are born a male, you are a male. If you are aging, you can cut your age short. So, those are the things that we cannot modify. But lifestyle, physical inactivity, all those kind of stuff can be modified. Education, lifestyle changes. What are some of the things that we can do to prevent us from getting high blood pressure or hypertension? And also, what are some of the things we can do to control it if we are diagnosed with it? So, if you're a smoker, we urge you to stop smoking, since smoking is one of the factors that causes high blood pressure. And so, we urge you to stop smoking. Also, we encourage you to control your blood glucose, especially if you are diabetic and also you have a high cholesterol levels. We encourage you to just control or take your medications as prescribed to control all those disease you might have. Also, diet is very essential. You have to eat healthy, eating vegetables, less sodium intake, that is salt, and then also eating less fatty foods. Moderate alcohol consumption, we encourage that you cut down the number of alcohol that you drink, because we find out that drinking too much can lead to a lot of problems and also hypertension. So we urge you to drink moderately, and if you can, stop drinking. So reduce sodium intake, that is salt, the amount of salt you're supposed to take, according to the articles or the evidence-based extracted. You have to reduce sodium intake to no more than 2,400 milligram a day. Physical activity, we encourage that you exercise at least 3 times in a week, and that helps also as well. And moderate to vigorous activity such as 3 to 4 days, walking, jogging, jumping, dancing, whichever way you prefer, but just exercise at least 3 times a week. So these are some of the food that we encourage you to eat. We have the DASH diet, and so this is how it looks like: more vegetables and some fruits, and helps to control. So when we say DASH diet, is the dietary approaches to stop hypertension. Also, when you see this smoking or cigarettes behind it, it's also advising you that smoking can lead to hypertension. That's we urge you to stop smoking as well. So serving portion. So many people have questioned about how to eat because they don't know how much we are talking about. But this serving portion picture, it just tells you how much you're supposed to eat. What a serving is: one medium fruit, how it looks like, and 3 ounce, how it looks like, roasted seafood, all those kind of stuff. Some of the oils we recommend, and how much you're supposed to take. So this tells you how much. If it's about grain, how much bread can you have in a day? How much fruit can you have in each serving? So this slide tells you about how much you can serve yourself in a day, so that, and also the required balanced diet you need to have, or the fruits, the cereal, or the protein aspect, or the fatty aspects that you're supposed to. Amount of sweets that you're supposed to. It's about 5 per week. And so all this slide talks about the seven portion. So exercising, like we said earlier, you can join yoga, running, jogging, dancing, so many ways you can do it. 3 days a week, it's enough. And drink enough water as well. When to treat hypertension. So when at all do you treat hypertension? So we go according to JNC 8, JNC 8, and so that we'll be able to treat appropriately and control the blood pressure for you. So in general population, pharmacology treatment should be initiated if BP is 150 out of 90 or higher in adults 60 years and older, or 140 over 90 in adults younger than 60. In patients with hypertension, diabetes, or under pharmacological treatments or whatsoever, we want your blood pressure to be treated if it's 140 over 90. So when to treat, and we continue on that. Initial treatment. So we have so many medications out there, but we follow JNC8 to treat hypertension. So a patient that walks to my office or clinic, I won't be able to just treat with any other medication, but I have to follow these guidelines. So we have thiazide diuretics, and they are the medications that helps you to pee a lot. We have calcium channel blocker, we have ACE inhibitor, we have ARB, and we have general non-black, which is initiated in general non-black population. So these type of medications can be given to any other race apart from a black. A thiazide diuretic or calcium channel blocker in the general black population. So these are some of the things some of the medications we can initiate if the patient comes and they are black. If goal not met 1 month after initiating a therapy, the dosage of the initial dose is increased or another medication is added. So the treatment, like the last slide we just ran over, we treat according to age and also race, and also the conditions you have, like diseases you might have. And so you can't just give any patients any medication, but we go according to the guidelines set by JNC 8. So general, our goal, our expectation is that for general, greater than 60 years and less than one, we want it to be less than 150 and 90. That's the goal. And then in general population that are less than 60 years, we want it below 140 and 90. And also those that come with, or those that have kidney issues, we want it to be less than 140 over 90. And diabetic patients, we want their goal to be 140 over 90. Thank you so much for being here with me throughout these lectures. But I did this slide for you to know that everything I'm teaching over here, I'm basing it on evidence-based practice, and I took it from these JNC and also CDC, and some of the lectures or some of the articles I pulled up, I also listed them here. So to prevent any plagiarism, I cited these on the last slide. Thank you, and remember to subscribe to my channel. And like I said, if you want the lecture entry, you can go to Gye Nyame channel. They have these slides, and I was able to educate in both Tree and English, and he was able to ask me questions which I answered, and it was fun. So make sure you go in and watch as well. Thank you. You have a good day. Bye.